Good afternoon. Our lecture for this afternoon would be on primary health care. So primary health, as we have known in our biopsychosocial aspects of disease, is caring for the whole person and not just focusing on the disease. It's the usually first point of contact for healthcare of a person, and it provides comprehensive, accessible, community-based care. So primary healthcare as a concept was declared in the International Conference of Primary Healthcare Alma-Ata, Kazakhstan, September 6 to 12, 1978. So this was 40 years ago, and it expressed the need for urgent action by all governments, all health and development workers, and the world community to protect and promote the health of all the people of the world. So, what are its declarations? The first declaration tells us that the conference strongly reaffirms that health, which is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity, is a fundamental human right. This is also the very definition of health that is used by the WHO. And that attaining the highest possible level of health is the most important worldwide social goal whose realization requires the action of many other social and economic sectors in addition to the health sector. The second declaration addresses the existing gross inequality in the health status of the people, particularly between developed and developing countries, as well as within countries, is politically, socially, and economically unacceptable and is therefore of common concern to all countries. While the third declaration states that economic and social development based on a new international economic order is of basic importance to the fullest attainment of health for all and to the reduction of the gap between the health status of the developing and developed countries. The promotion and protection of the health of the people is essential to sustained economic and social development and contributes to a better quality of life and to world peace. The fourth declaration states that health is a right and a duty to participate individually and collectively in the planning and implementation of their health care. The fifth declaration focuses on governments, which would have a responsibility for the health of their people, which can be fulfilled only by the provision of adequate health and social measures, a main social target of which governments, international organizations, and the whole world community in the coming decades should be the attainment by all peoples of the world by the year 2000 of a level of health that will permit them to lead a socially and economically productive life. Primary health care is the key to attaining this target as part of development in the spirit of social justice. The sixth declaration states that primary health care is essential health care based on practical, scientifically sound, and socially acceptable methods and technology made universally accessible to individuals and families in the community through their full participation and at a cost that the community and country can afford to maintain at every stage of their development in the spirit of self-reliance and self-determination. It forms an integral part both of the country's health system, of which it is the central function and main focus, and of the overall social and economic development of the community. It is the first level of contact of individuals, the family and community with the national health system, bringing health care as close as possible to where people live and work, and constitutes the first element of a continuing health care process. Primary health care reflects and evolves from the economic conditions and socio-cultural and political characteristics of the country and its communities, and is based on the application of the relevant results of social, biomedical, and health services, research, and public health experience. It addresses the main health problems in the community, providing promotive, preventive, curative, rehabilitative services accordingly. Includes at least education concerning prevailing health problems and the methods of preventing and controlling them, promotion of food supply and proper nutrition, an adequate supply of safe water and basic sanitation, maternal and child health care, including family planning, immunization against the major infectious diseases, prevention and control of locally endemic diseases, appropriate treatment of common diseases and injuries, and provision of essential drugs. It involves, in addition to the health sector, all related sectors and aspects of national and community development, in particular agriculture, animal husbandry, food, industry, education, housing, public works, communications, and other sectors, and demands the coordinated efforts of all those sectors. It requires and promotes maximum community and individual self-reliance and participation in the planning, organization, operation, and control of primary health care, making fullest use of local, national, and other available resources, and to this end develops through appropriate education the ability of communities to participate. Primary health care should be sustained by integrated, functional, and mutually supportive referral systems, leading to the progressive improvement of comprehensive health care for all and giving priority to those most in need. It relies at local and referral levels on health workers, including physicians, nurses, midwives, auxiliaries, and community workers as applicable, as well as traditional practitioners as needed, suitably trained socially and technically to work as a health team and to respond to the expressed health needs of the community. All governments should formulate national policies, strategies, and plans of action to launch and sustain primary health care as part of a comprehensive national health system and in coordination with other sectors. To this end, it will be necessary to exercise political will to mobilize the country's resources and to use available external resources rationally. All countries should cooperate in a spirit of partnership and service to ensure primary health care for all people, since the attainment of health by people in any one country directly concerns and benefits every other country. In this context, the joint WHO-UNICEF report on primary health care constitutes a solid basis for the further development and operation of primary health care throughout the world. An acceptable level of health for all the people of the world by the year 2000 can be attained through a fuller and better use of the world's resources, a considerable part of which is now spent on armaments and military conflicts. A genuine policy of independence, peace, and disarmament could and should release additional resources that could well be devoted to peaceful aims and in particular to the acceleration of social and economic development, of which primary health care as an essential part should be allotted its proper share. And 40 years after it is still the most effective way to sustainably solve today's health problems through universal health care and through sustainable development goals. After 40 years, there was an global conference on primary health care held in Kazakhstan October 2018. The role of primary health care was re-emphasized, making it the highest possible attainable standard of health for the people. It envisions governments and societies that prioritizes, promotes, and protects people's health and well-being at both population and individual levels through strong health, primary health care and health services that are high quality, safe, comprehensive, integrated, accessible, available, and affordable for everyone and everywhere, provided with compassion, respect, and dignity by health professionals who are well trained, skilled, motivated, and committed. It enables and health conducive environments in which individuals and communities are empowered and engaged in maintaining and enhancing their health and well-being. Partners and stakeholders aligned in providing effective support to national health policies, strategies, and plans. The first declaration in the Astana Declaration strongly affirms our commitment to the fundamental right of every human being to the enjoyment of the highest attainable standard of health without distinction of any kind. Convening on the 40th anniversary of the Declaration of Alma-Ata, we reaffirm our commitment to all its values and principles, in particular to justice and solidarity, and we underline the importance of health for peace, security, and socio-economic development and their interdependence. The second declaration is convinced that strengthening primary health care is the most inclusive, effective, and efficient approach to enhance people's physical and mental health as well as social well-being, and that primary health care is a cornerstone of a sustainable health system for universal health coverage and health-related sustainable development goals. We welcome the convening in 2019 of the UN General Assembly High-Level Meeting on Universal Health Care, to which this declaration will contribute. We will each pursue our paths to achieving UHC so that all people have equitable access to the quality and effective health care they need, that the use of these services would not bring them into financial hardship. The third declaration acknowledges that in spite of remarkable progress over the last 40 years, people in all parts of the world still have unaddressed health needs. Remaining healthy is challenging for many people, especially the poor and people in vulnerable situations. We find it ethically, politically, socially, and economically unacceptable that inequity in health and disparities in health outcomes persist. The fourth aspires to make bold political choices for health across all sectors and build sustainable primary health care. So that is your Astana Declaration for you in a nutshell. So to end primary health care, let me share with you four levels of participation. We have hospital or clinic based. This is what we are all exposed to. Then we have community-oriented, community-based, and community-managed. It has guiding principles, so health to the people, health for the people, health with the people, and health by the people with different characteristics, with being authoritarian, paternalistic, democratic to liberating on the different ends of the spectrum. So they have different initial and tacit objectives, which you will see in the table. So from a rigid and statistics-oriented, hospital-oriented practice, Community manage wants us to formulate health strategies formulated by the community and based on their felt needs, vision of an alternative social order expressed by the people. For tacit objectives, you maintain the status quo, so what we are used to, as to a complete restructuring of the health system together with socio-economic transformation. So these are the people responsible for health. So on one end, it's the doctor's sole responsibility. As to the other, everyone is involved. Health professionals, recipients of health care, look at your patients. On the other hand, your patients are the managers of their own health programs. And we have different levels of community participation for these different levels. So for your exam, know the different levels of participation by studying these last two slides very well. Okay? So it has different views on awareness building, value given to community organizing, and data gathering, monitoring, and evaluation. This you would appreciate better when we look at our latter lectures in organizing and community participation. They have different linkages, effect on the people, and the general impact on it on primary health.